Hello and welcome to the Hot Pot with Princess and the DJ. I'm Princess May, aka the Princess, and as you can tell, our DJ Tracy isn't here. Instead, we have a new co-host, Chris, who is with When Does It End?
Hey, what's up? What's going on? For those of you who know me, nice to see you again. But if you don't, my name is Chris, and I am one half of the podcast entitled When Does It End, where we talk about the 4 pillars to ending the HIV epidemic through prevention, diagnosing, treatment, and responding through everything sex, culture, and the people impacted. Princess, thank you for allowing me being here today with you in amazing DC to share this space and to talk some real talk. Can we talk some real talk?
Definitely, yeah. Looking forward to it.
And then it's not only us today. As you can see, we have an amazing guest to our left. So Torrian, please introduce yourself and tell the people who you are, where you're from, what you do, and why you do it.
Yeah, thanks, Chris. So my name is Torrian Baskerville. First of all, thank you for inviting me on and having me as your guest. So I am the director of HIV and Health Equity at the Human Rights Campaign. And I've gotten into this work, HIV specifically, 11 years ago. And it wasn't something that I, wanted to do or necessarily planned to do. I was living in Atlanta at a time. And I was like, I'm moving back home to Jersey, and I called my mentor and I was like, hey, I need a job. And so I started as an office manager for Newark EMA, or the eligible metropolitan area. And I just started listening to their meetings and hearing how HIV was impacting Black and Latinx, gay, bisexual, and other same-gender loving men, and decided that I needed to do something more about it. And a year later, I started direct services with young people and loved it and was great at it, and here I am now.
Nice. So yeah, thank you so much for sharing. You've been in your work for 11 years. I would love to hear how kind of your work has shifted. We've gone through a pandemic, we went through COVID, we went through, right now is monkeypox. How has that shifted through those 11 years?
Yeah, so it shifted like tremendously. Right now I'm a director, but I've been a prep coordinator. I've been a tester, and so I bring all of those things to the work with me. What I realized over the years is that we can do a lot of work on the individual level, right? Talk about risk, talk about education, talk about healthiness, but if the structural things are not supporting that, right? So if we don't have policies and if we don't have laws that support that work, then we're probably not doing our best work, right? It really is not going to move the needle in the way that we want it to move, which is why we are still seeing black and brown, gay, bisexual, and other men who have sex with men still highly impacted by HIV. And also these other epidemics that come along, i.e. Mpox or monkeypox.
And so I'm happy that you brought up monkeypox because I would like to take a shift in the conversation. Can you talk a bit more about the local monkeypox epidemic or what you're doing at HRC to be impactful in your approach to make sure people are aware and have access to monkeypox vaccination?
Yeah, so it's funny because I am on my 98th day at HRC, and yes, I am counting. And I'm counting because literally my 3rd day in, I had a meeting with Dr. Dimitri, and we were having conversations about Mpox and how the White House, or the CDC at the time, before he moved over to the White House, how they can really do vaccine distribution in a way that's equitable, right, and prioritizing Black and Latinx individuals. Because what we were seeing initially was that individuals who were going to get the vaccines, the limited vaccines that we had available, were going to white gay men, right? But we also know at the same time that the impact of Mpox was really among Black and Latinx, gay, bisexual, and other same-gender loving men. And so we really just began a public education campaign where we started a resource page. We created a resource page. We started collecting data and collecting information from other jurisdictions of who was actually had access to vaccines, which was very limited, right? And then we ran into some barriers. For example, some jurisdictions was placing these really outrageous, stigmatizing restrictions or regulations on things. Like, for example, you had to have sex with more than 3 partners in order to get vaccinated. Like, come on, you know what I mean? That's all that do is perpetuate over-sexualization of gay men, right? And so we took all of those stories that were coming in from people that I knew that was experiencing these things, and we really kept having meetings and talking with them like, this is what needs to happen. And so that's how we just continue to do that. And because of that work, we got a part of a partnership with Gilead and 4 other community-based organizations who were leading doing that work, to do more of it and some funding to support the work that we were already doing. And so there's a lot that we're doing. We're doing town halls throughout the country, working with community-based organizations in highly impacted communities, trying to get the information out to individuals, trying to get individuals vaccinated by working with local health departments or state health departments who are doing vaccinations. But then there's also some community-based organizations that are also doing vaccinations. And so really partnering and working with them. We're tackling it on all different fronts while still urging federal and state officials to provide funding for Mpox and to provide funding specifically to sexual health clinics, to community-based organizations, because we know that those organizations and those entities who are really placed within community, know community, and community utilize those. And so it's important that we stay connected to those things.
Yeah, I kind of want to make 2 comments about what you mentioned. Well, one, I live in the Bay Area, so that's why there's an influx of vaccinations there, and that's the community being served. But when you look anywhere else, there really aren't vaccinations available in other states. I've looked at like Texas, and just Googling, it's like contact your health department, but they don't even have it as well. But another point that you mentioned was stigma. And there's so much stigma around monkeypox right now, and there was once monkeypox was kind of released into the public. It's something known, it's a virus coming out, everyone knows about it, but there was so much stigma around that and who should receive a vaccine or if we should even do work around monkeypox. I'd love to hear kind of a little bit more of your insight on the stigma that took place in the beginning and even now.
Yeah, you know, you spoke to a little bit of it within your question, like that, you know, when monkeypox first hit, you know, I remember a federal public health official going on a national platform, televised platform, and associating Mpox with Black, Latinx, gay, bisexual, and same-gender loving men, right? That in and of itself is stigmatizing, right? The other thing is they went further and decided to, the first cases where infants or children contracted it, they literally connected the children getting exposed to it, connecting it to gay, bisexual, and other same-gender loving men. And so that only furthers the stigma, right? Could you imagine, you know, someone listening to that and then hearing, oh my God, you know, gay people are infecting even children with Mpox, right? That is alarming and that's extremely problematic. And so it was language, right? So connecting this and people calling it a gay disease, right? Which is very similar, we know, you know, when HIV first came out, right? Like associating that with the LGBTQ community. And so we saw it and it was immediately something that we was like, we need to do it, especially as the largest LGBTQ organization within the country. It was important that we took a stance on that, you know? When we also talk about stigma, when we talk about, again, as I said earlier, when you're going into a health department and you have to have this certain amount of sexual partners in order to get it, is in and of itself problematic, right? Or when you have individuals who are attempting to get treatment or get tested or get vaccinated and are being turned away, right? Because they are not having as much sex or because they don't look like what people are saying the most impacted communities are. You know, those are challenges. I think one thing that I've always been saying in this process is that we are human beings and we are not subjected to one area, right? If we're not dealing with the whole community, then we're not really making a good approach, right? And we're not really doing public health service, we're doing it a disservice. Right.
So before I go into my next question, I want to say thank you for the work that you've done and the work that you will continue to do to advocate for people who have fell through the gaps, to advocate for the unseen, and to make them be seen in places where we have traditionally been unseen. And so in your last point of discussion, we talked a lot about we talked about sexual orientation, but we also brought up the idea about Black and brown bodies, not having access to vaccinations or education. And so I want to kind of shift the discussion to talk about how do you feel medical mistrust plays a role into folks getting vaccinated for monkeypox and people being made aware about monkeypox, because we know that when it comes to Black and brown communities, there's a vast level of mistrust due to things such as documentation status for immigrants and due to things and historical trauma such as Tuskegee, primarily for Black same-gender loving men. So I want to ask you, in your opinion, what roles does medical mistrust play in the monkeypox epidemic, and what can we do as public health practitioners and as stewards of safety can do? What can we collectively do to try to end that mistrust?
Yeah, you know, to your point, right? This is not a new phenomenon, right? Especially when we talk about Black and Latinx communities at large, but even more when we talk about same-gender loving individuals, right? Because what we know is that oftentimes our communities have been the ones that has been disenfranchised, right? When COVID vaccination first came out, right? Many people who look like us were not going to get the vaccine, right? Because we didn't trust the government, right? We didn't trust the ability or the efficacy of the vaccine. I particularly got the vaccine once my mother got it, once my best friend and his husband got it, and then my dad got it. When they all got it, I said, y'all all got it and y'all are healthy and good. That means I can get it. So I literally went and got the exact same one that they got, right? Because what we know is that within our communities, antidotes are important, right? Us being able to go to Christopher and say, Chris, you should get vaccinated. So when we have those conversations, it's important. So when we talk about Mpox vaccination, it's that same idea, right? We having to tell the story of us getting it and how we are still healthy and the importance of getting it, right? And giving the education. And also being clear that I don't believe in relegating people's bodies, right? So it's about providing all of the information, right? And allowing that person to make what they feel is the best decision for their life. The other part of it is what I said earlier. It's important that the federal government, state and local officials work with community-based organizations and work with individuals and advocates within the community who knows community and that community knows them. Because that is how you build trust. That is how you show that we are prioritizing you in the community and we see you and we hear you and we understand, right, what your needs are and how to get you the needs that you have.
Yes, 100%, and totally agree with you. And thank you for sharing your personal story, because I worked in COVID-19 work immediately after I graduated from grad school, and something that was missing when we were doing contact tracing, when we were just giving out vaccinations, was we weren't reaching out to communities. Communities had that hesitation to get vaccinated, and it's like, what do we do now? And at the core, what we should have done was reach out to community members who are doing the work on the ground, who are part of the community, working with the community, and they know they're already trusted leaders within their community to do that work. So it totally makes sense that, you know, especially with monkeypox and every pandemic that we'll go through, is that we really need to look at communities and how we can uplift them. And it shouldn't be because we've experienced all of these viruses and diseases. It should be, we should always reach out to these communities to do that work.
Based off what you said, I got three things. And so, like, I'm a person who thinks of topics of conversation and thinks of ideas in figures. So as you were talking, the thing that was repeatedly coming up in my mind was a triad. It was a triangle with 3 points. And so what's needed is that we need education, we need awareness, and we need representation. Somebody always gets left behind. And the thing about people getting left behind, traditionally the people who get left behind are the people who need the most help. And so in the thought of moving forward with this triadic mindset of education, awareness, and representation, how do you feel the response of the world has changed depending on the varying levels of different epidemics and pandemics that passed? So could you compare and contrast the world's response to monkeypox and HIV or even COVID itself?
Yeah, so I love your triad, right? I'm gonna offer a substitution for one of them, right? And It's the awareness piece, because I think the awareness is embedded in the education, right? Once I educate you, you are now aware of a thing, but the A is accessibility. We need to talk about access, right? Because just because I know about a thing doesn't mean I have access to that same thing, right? And doesn't mean that communities have this same level of access to that same thing. We talk about Mpox, right? Communities knew about Mpox. Education was getting to these communities, yet when individuals were going to get the vaccination, they didn't have access to it, right? And so we can talk about, education, which is important, representation, which is important, but we need accessibility. It took the government years and a while before they even acknowledged that HIV was a thing, right? Let's think about COVID. It took the government a while. And some still are saying COVID-19 is not a real thing, right? And so Mpox is that same way, in that the government's response to Mpox was lagging and was lackadaisical, right? Because of what we know is that if we responded weeks prior, right, we could have carteled this drastically, right? And so I think that's what we have to remember. And what I always say is that, government is very actionary, right? Something has to happen in order for government to respond. And we have to get to a place where government is proactive, knowing all of the information and all the intel that we have and that the president gets on a daily basis, right? There has to be some level of preparedness, right, that goes into forward thinking. I think it's important for us to do that work. We have to be the gap fillers, right? We know that, unfortunately, we may never trust government. And that's just a reality, right? That's just a reality. When we think about even voting, many Black people don't vote because they don't trust the system. They don't trust that their vote counts, right? And so, I think none of this works in isolation. All of this is connected. All of this is intertwined. And so we have to take, to the point, a triad approach. We have to take a holistic, concerted approach to how we are dealing with all of these things. And so those things were lacking, which is why we are seeing, again, those who are often disenfranchised, those who are often disproportionately impacted by all ailments that happen, all pandemics, epidemics, illnesses that happen in America, are again the same most impacted within Mpox.
Yeah. I mean, you've been in your work for 11 years. I've started my public health career in 2020 when I graduated from grad school, and I'm sure you've been in public health for a few years as well. And it's like, you can almost think of kind of a dream of what it should look like and what we hope and aspire public health to truly be and what we can accomplish being with communities. I'd love to hear a little bit more about that, but then how can we make sure that communities that are often forgotten are remembered, but how do we make sure the public health workforce isn't the only workforce, making sure it happens in our communities?
I believe in being aspirational. I also believe in being a realist, right? And I think, this is why I do the work, really, is about bringing visibility, right, to those communities, right? And also doing my best to engage them in the process of things, right? I know that I am privileged to sit in the space that I sit, coming from where I come from in Newark, New Jersey, right? Having experienced some of the same challenges that, other individuals have. And so it's incumbent upon me, it's important that I go back and bring other people along, right? And so I think it's just important that we, you, Chris, that we do the work, and other advocates really do the work of bringing community in and bringing that visibility to them. Because unfortunately, the government doesn't always do that, and we have to fill in the gaps.
Thank you for that. And so earlier when I did my introduction, I talked a little bit about my podcast and what we do. And so my podcast is surrounded by the EHE initiative. So the Ending the HIV Epidemic, which is based on the 4 pillars that prevent, diagnose, treatment, and respond. And so we've talked a little bit about all those pieces for today, but just to wrap up, can you tell our viewers, can you give them a few hints or some things that they can take with themselves once they view this today or after they view this on how they can prevent, treat, diagnose, and respond not only to monkeypox within our own communities, but to HIV and to whatever pandemic the universe throws at us in the future.
Yeah, so I think it's important, and I'm going to go back to your triad, Christopher. It's important to get educated. It's important that you educate yourself, but you also go to communities that are able to educate you, right? Secondly, you have to become aware and be aware, but also get accessible to those things, right? Have accessibility to that. And so I would just say, get tested. Go get tested. And if you are not a person who gets comfortable with being tested, take a friend with you. Call me up, I'll go with you, right? And if you're in the DMV area, I got you, right? And if you're in other areas, I know people around the country, I can connect you with someone who can get you, because that's how we're gonna do it. We have to do it as a community. And oftentimes in LGBTQ communities and in Black communities and brown communities, we have always had to be the solution for our communities. And so we have to continue to do that. So go get tested, go get treatment. Go get PrEP, go get vaccinated.
Thank you so much for joining us and giving that last nugget of advice and really emphasizing the work our community is doing and that we are a community and the work that we do are for one another.
Yeah, thank you both.
Hey, you know what? Until we meet again, this is
The Hot Pot.
And When Does It End? And we'll see you soon. Peace.